So one of the other components that we want to have inside of this plan is we want to make sure that we have a return check fee, service charge of $50. Very easy for your bank to charge you $50 for a return check. And with that stated, as far as a return check goes, we also want to make sure we have all forms of payment availability for folks. Short of accepting cryptocurrency, I think we want to make sure that we take Apple Pay, we take Google Pay, etc. All credit cards, debit cards, and so forth. Talk a little bit about the idea of charging for forms. It's an important thing. Sometimes these requests are for large numbers of pages. It's records that we've got to print out of our EHR, or if we have a paper record scenario where we've got to go grab records and copy them. So you want to handle that as well. No-show fees. We want to establish no-show fees. Depending on the type of practice you are. If you're a specialist, you might be in higher demand. You might have a higher no-show fee. If you're a practice that's seeing patients regularly, 3 no-shows in a year. No-show being defined as, you don't give us 24-hour notice before your appointment, you get charged whatever, $50, let's say. 3 no-shows in a year, you're discharged from the practice. Again, they've signed off, they've agreed to this. If you have out-of-network carriers, patients that want to see you, but they're out-of-network, you can establish a self-pay fee schedule. Another really important thing that's really come on the scene recently with the whole No Surprise Act, bill that came on the scene federally January 1st, 22, is the idea of providing good faith estimates to your patients. A very we could do 2 episodes talking about this, but good practice to stay in compliance, to make sure you're doing this where necessary.